talked about outcomes. That plays out in so many ways, but especially nowadays to partner along with hospitals and other in the care continuum. Can you talk about what your company's done as far as making yourself a valuable partner?
Sure. I'm really excited. I have actually been approached by two ACOs. One is physician driven, it's not hospital driven, and the other one is hospital driven. But the hospital, I've been in that community for so many years, and I know a lot of the people with that hospital or a part of the hospital and on the board. They've actually asked me to partner in building and creating the ACO that the hospital's working with. So I was real excited to get part and parcel to that groundwork, and those meetings are just now starting.
Have you had to do a lot of work on your end to get up to speed on that issue, or are you sort of familiar with value-based care or incentive-based care?
Fortunately, I listen to these meetings. Being part of the association, being on the board with the association, has given me the opportunity to talk to some very brilliant people with very brilliant minds.
Right.
And I've asked questions because I knew it was whatever happens in the West Coast coming to the East Coast.
Right.
So I try to stay abreast of what's happening in the California and the Arizona areas, and I'm afforded that with being part of the board, and I'm very lucky. And I get a lot of insight, and I learn, and they share. There's a lot of sharing. There's a lot of camaraderie that we have in this great association, and it's just one of the best parts about being a part of it.
Great. And lastly, priorities heading into 2018. We're sort of getting toward the ends of 2017. What items are on your list maybe as you look ahead?
Well, certainly working with the association and trying to either delay or stop the requirements of participation.
Right.
They are completely burdensome. They are expensive and not necessarily going to produce better outcomes or better patient care. So trying to shave some of that back would be one of the priorities that I would have working with the association. But as far as my company, getting everyone geared up, getting everyone ready, trying to learn how to do higher quality care at a better value, and partnering with your pharmacies and partnering with your therapy companies and trying to find ways to get the same clinical outcomes with less days potentially. One of the things is working with the pharmacy and trying to get better formularies to reduce the cost of those pharmacy costs. So I guess basically trying to see how we meet the needs of these patients and reduce costs, because that's what everybody's wanting the big picture to be driven to.
Great.